Spontaneous resorption of herniated lumbar discs. It is known that some disc herniations resorb while others do not, but there's no agreement as to why. In one recent study, approximately 63% of patients had a natural reduction in the size of their disc herniation, yet there were no indicators as to why this occurred. Are there findings on MRI that can be used to predict resorption, and are there types of herniations that more likely resorb than others? The study we will review in this presentation helps shed light on this topic. But first, what is known about resorption? The resorption process requires matrix metalloproteinases, or MMPs. Previously, these were called collagenase, gelatinase, stromolysin, and elastase. Now these are termed MMP1, 2, 3, and 12, respectively. Specifically, MMP3 may be particularly important in disc resorption by generating a bioactive macrophage chemoattractant. The process of resorption is terminated by tissue inhibitors of MMPs. The MMP-TIMP balance is essential for reducing the size of the herniation and decrease in inflammation. The study we will discuss involves what are called Modic changes on MRI. So let's review a couple of items first before discussing this study. Modic changes represent signal changes on MRI that indicate end plate and subchondral bone effects that have been tied to disc herniation. A quick reminder that on T1 weighted images, fluid with higher water content is dark, whereas on T2 weighted images, it is bright. So that on a sagittal lumbar MRI, CSF is bright on T2 and dark on T1, and the nucleus is bright on T2 and dark on T1. There are three types, so let's review these using actual images. Type 1 involves decreased signal intensity on T1 and increased signal intensity on T2 weighted images, representing bone marrow edema and inflammation. Type 2 involves increased signal intensity on T1 weighted images and slightly increased or isointense intensity on T2 weighted images. This represents normal red hematopoietic bone marrow conversion into yellow fat marrow as a result of marrow ischemia. And type 3 involves decreased signal intensity on both T1 and T2 weighted images, representing subchondral bone sclerosis. A few other features of interest are that type 1 MCs are most associated with disc herniations that contain hyaline cartilage from the vertebral end plate. MCs found in association with lumbar disc herniation increase the risk of bacterial infection of the disc. This may explain why some patients with low back pain respond to antibiotic therapy. Resorption may involve loss of proteoglycans from herniated tissue that then swells, with invasion by blood-derived cells that set up an inflammatory reaction with varying degrees of vascularization based on the components of the herniated disc tissue, which then may influence resorption. Hyaline cartilage, which does not normally swell, will be more resistant to resorption. Now to the study of interest, entitled Spontaneous Resorption of Lumbar Disc Herniation is Less Likely When Modic Changes Are Present, published in Spine in 2014. This was a dual-purpose study. First, to determine what, if any, relationship there is between modic changes and spontaneous disc resorption in patients with disc herniation and radiculopathy who underwent conservative treatment incorporating a rehabilitation approach, and second, to compare the tissue composition of herniated disc tissues taken from surgical patients with and without modic changes. This was not a comparative study of effectiveness. So how were patients selected and assigned? Well, 85 consecutive patients with single-level lumbar disc herniations were selected, including 52 males and 33 females. All patients had a clinical, CT, and MRI exam. Patients who failed conservative care for 3 months and had canal stenosis due to lumbar disc herniation were assigned to surgery. Patients in the conservative group, who totaled 30, did not meet the surgical criteria and were treated with a rehabilitation program. The patients in the surgery group totaled 55. They were treated with fenestration and nucleotomy with the removed disc material stored and prepared for analysis. Lumbar MRI examination was repeated at 6-month follow-up in all patients. The Oswestry Disability Index was measured at baseline and a 6-month follow-up. For cultural reasons, the question on sexual function was omitted, leaving a total of 45 possible points. The researchers classified scores as 0 to 14 as mild functional impairment, 15 to 29 as moderate functional impairment, and 30 to 45 as severe functional impairment. So how many patients had Modic changes? Well, in the conservative group, 15 patients showed MCs on MRI, 3 type 1s, and 12 type 2s, while the remaining 15 had no MCs. In the surgical treatment group, 20 patients demonstrated MCs on preoperative MRI, with 6 type 1s and 14 type 2s, whereas the other 35 did not have any Modic changes. That's the majority of surgical cases and 50 out of the total 85 patients in this study. In total, there were only 9 patients with type 1 MCs, and no patients had type 3 MCs. It's important to note that in previous studies, the type of Modic change did not correlate with visual analog scales or Oswestry disability scores before or after surgery. Let's quickly review the process of resorption. New capillaries and macrophages accumulate in herniated tissue, and because intervertebral discs are normally avascular, contact between blood and the extruded nucleus pulposus may initiate a severe inflammatory response. New capillaries and macrophage infiltration, especially the latter, play important roles in the spontaneous resorption of herniated discs. Macrophages secrete mediators such as interleukin-1 beta and tumor necrosis factor alpha that enhance inflammation and promote the spontaneous resorption of herniated discs, but they also increase the risk of neural pressure and irritation leading to sciatica. For this study on MRI, the cross-sectional area of the herniated mass was measured on every image and the volume was calculated. From surgery patients, slices of disc material were stained to determine content as either annulus fibrosus, nucleus pulposus, or cartilage end plate. Cells and capillaries were counted. So for Modic positive patients, herniated material was comprised of 50% cartilaginous end plate, 18% nucleus pulposus, and 32% annulus fibrosus. Whereas in the non-Modic positive patients, cartilaginous end plate represented only 8% of cells, nucleus pulposus 55% of cells, and 37% of cells were annulus fibrosus. So to summarize, herniated disc tissue in the MC group had more hyaline cartilage and less nucleus pulposus than in the non-MC group, although the annulus fibrosus content was similar. Herniated tissue from patients with MCs contained relatively more hyaline cartilage end plate and relatively less nucleus pulposus. It is proposed also that the cartilage end plate contains or secretes vascularization inhibitors, resulting in decreased neovascularization and decreased inflammation. More capillaries were found in herniated specimens from patients without MCs than those with MCs. Macrophages were more abundant in specimens from patients without MCs. Patients with MCs showed less vascular invasion and consequently less resorption, possibly due to their cartilage-rich herniations. Herniated volume was reduced in 67% or 10 out of 15 of the MC group, compared with 93% or 14 out of 15 of the non-MC group. Oswestry disability score reduction for the conservative treatment group was 60% of patients, 9 out of 15, in the MC group, compared to 100% of patients, 15 out of 15, without MCs at 6-month follow-up. Because hyaline cartilage can come only from the vertebral end plate and is likely avulsed by a herniated annulus, it will greatly increase the permeability of the end plate and allow greater migration of biological agents from the disc to the vertebral body and vice versa, stimulating the development of Modic changes. In this way, MCs may act as a marker for cartilaginous disc herniation that resorbs poorly. Other studies indicate that MCs affecting the central portion of the superior cartilaginous end plate may indicate a history of recurrent lumbar disc herniation and is a negative predictor of response to care. Some observations. This is a relatively small study with regard to number of patients, yet the trend of the statistics points in the direction of significance. The rehabilitation program is not described, but this may be because the researchers actually consider it more like natural history. One of the most interesting questions brought out by this study is, why is it that so many patients without Modic changes ended up being surgical candidates? In other words, although it appears that not having Modic changes in the conservatively managed group predicted resorption, not having Modic changes in the surgical group did not differentiate surgical versus non-surgical candidates. Remember that one of the surgical criteria was failure of conservative management for 3 months. So why is it not having Modic changes is predictive for resorption and recovery in the conservatively managed group, but not predictive for those who failed conservative management in the surgery group? We don't know what conservative management means in the surgery group, and we don't know what specific rehabilitative program was utilized in the conservatively managed group in this study. Is that difference important to the findings? Also, would waiting an additional 3 months for the 6-month follow-up increase the likelihood of improvement in some that were selected for surgery? So let's summarize. Based on this study, the more typical nucleus-rich herniation is more likely to resorb due to new capillary formation, but the MC-associated disc herniations are less likely to heal due to their more cartilage-rich composition. The researchers conclude that conservative treatment is less likely to be effective for patients with lumbar disc herniations with Modic changes. So the question then is, should MRI be ordered in patients with clinically evident radiculopathy to determine response to natural history or conservative care? This study's results certainly suggest so, but more studies are needed.